Knock knock.
Hello.
Hi, I'm student nurse Messiah Widger, and I'll be performing a head to assessment on you today.
Okay.
Okay, I'm going to start off by performing hand hygiene. Just put an infection. Okay, how are you feeling today?
I'm feeling okay, except for a little pain in my left shoulder and my arm.
Okay, can you rate the pain on the scale from 1 to 10?
It's about a 4.
Okay, can you describe what kind of pain it is?
It's like a throbbing pain.
Okay, gotcha. So throughout the assessment, I'll be assessing what's abnormal so we can seek the best treatment, okay?
Mm-hmm.
Okay, so I'm going to first start off by verifying your name and date of birth. Can you see your name and date of birth?
Altariq Witcher,
Okay.
8765.
Okay, I'm checking your wristband for clarification. Okay, I want you to know, per HIPAA law, any information exchanged between us today will be kept confidential unless being shared with our team members. Is that okay with you?
That's fine.
Okay. Do you have any allergies to be aware of?
No.
Okay, before we go any further, can I close the current to provide some privacy?
Oh, sure, yes, that'll be great.
Okay. Okay, so moving on to the general survey, I note that during the introduction, Altariq's responses to the questions prove that his speech and ability to communicate is clear and effective. May I ask you to stay where you are right now?
I'm in the doctor's office.
What day is it?
December 11th, 2020.
Okay, who am I?
Nursing student, Miss Witcher.
Okay, so this proves that he is alert and oriented to place, time, and person. And I would like to note that he also seems like he's well groomed and has good personal hygiene. And next, I'm noting any medical devices attached to the patient, and there are none. And now I'll be going to inspect the head, and I'm noting that the skin color is even in tone and pigmentation. The face is symmetrical, no signs of drooping. Palpable fissures are also symmetrical. There are no redness or jaundice detected in the eyes. Eyelashes and eyebrows are present. There is no dryness or cracking of the lips or around the lips. Again, or around the lips. And alright, and now I'll be going to assess visual acuity. And that's cranial nerve number 2.
Okay.
Okay. Okay. So I'll be showing you the Snellen chart, and I want you to cover your right eye first.
Okay.
I want you to read from the top of the chart until you can't read anymore.
Okay. E, F, P, T, O, Z, L, P, E, D. That's it.
Okay, and now I want you to cover your left eye.
Okay. E, F, P, T, O, Z, L, P, E, D.
Okay. So overall, his visual acuity of both eyes is going to be 20/50. So that proves that that cranial nerve number 2 is intact.
Mm-hmm.
And now we'll go on to assess cranial nerve number 4. And I'm going to put on your lids, and I want you to look up.
Mm-hmm.
Okay, I'm noting the color and the color of the conjunctiva and the sclera. The sclera is glossy white, conjunctiva. There's no redness detected. So cranial nerve number 4 is intact. Also, I will also reassert some cranial nerve 3, 4, and 6 by doing the 6 cardinal fields of gaze. So this is myself, and I'm going to ask you to follow the pen light, but down over your head, follow the pen light with your eyes, and I'm noting any shaking in the eye or any nystagmus. Okay, there's none noted. So cranial nerve 3, 4, and 6 are intact. Now I'm going to do accommodation. I'm going to position the pen light in the middle of the nose. I'm going to move it inward. And I note that there is convergence of the axis of the eyes. So, and now I will go on to assess pupillary light reflex, which dim and light sense when you stare at a distant object. I'm going to shine a light from on both sides. Note that there is bilateral constriction in both eyes. So concentric direct light response. Okay. So there's bilateral constriction, which is a normal response for the eyes. And lastly, I'm going to note that now we can describe as perla. So the pupils are equal on the size, about 4 millimeters bilaterally. They're round. They're reactive to light. And accommodation. Okay. So now we're going on to assess facial nerve. Cranial nerve number 5. We're gonna feel on both sides and pinch your teeth. And open mouth. Okay, there's equal movement on both sides. And I'm gonna ask you to close your mouth, and I'm gonna open your mouth against resistance. Okay, also normal. Then cranial nerve number 7, I'm going to test, which is you squint your eyes, open, smile, frown, puff out cheeks. Okay, so both cranial nerves number 5 and number 7 are in check. And now I will go on to assess the respiratory rate. And I want to ask, do you have any shortness of breath?
No.
Experiencing any cough?
No.
You have history of smoking?
No.
Okay. So we're going to assess the respiratory rate for 1 full minute. I'm going to be noting the rise and fall of the chest and the characteristic of breathing. Okay, so noting that the rise and fall of the chest is equal in expansion. Breathing is nor shallow or deep. Breathing is mostly normal. Yeah, breathing is normal. No shallow or deepness. Okay. No difficulty breathing, right?
No.
Okay, so respiratory rate is 16 breaths per minute, which is normal for an adult. Okay, now we'll go on to let's auscultate over the lung fields, noting any adventitious sounds, any crackles, wheezes, or shudder sounds. Okay, we're gonna start off about the crackle. Starting at the mechanical line. Breathe in and out. 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 May I ask you to turn around so I can also take the posterior side of the chest? And I'm going to hunch over so you can, okay? Clavicle, breathe in and out. Once again, noting any adventitious sounds. Breathing out. Breathe in and 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 out. So there were no adventitious sounds, no detected, no crackles, no wheezes, so it's normal. Now we'll go on to test the cardiac. So do you have any chest pain while breathing?
No.
Any past cardiac history?
No.
Okay. Any shortness of breath?
No.
Okay, so just move on to the side. Good.
Okay.
Now I'm going to start at the So now I'm going to start the aortic valve. It's on the right sternal border of the chest. Second ICS is where the S2 sounds are heard the most. Now I'm going to go on to the pulmonic sound, where the S2 sound is also produced. And both of these valves make up the semilunar valves. Now I will move on and go and flip my stethoscope over to the Erb's point, where I would assess any murmurs. No murmurs are present. There's ICS. And now I will go on to the fifth ICS, the tricuspid valve, which is a part of the AV valves. And they produce the S1 along with the mitral valve. And the mitral valve is also where we were listening to the apical rate for one full minute. So okay, the apical heart rate is 82 beats per minute, which is a normal range. Okay, so now I will go on to assess the abdomen. Before I assess the abdomen, do you have any abdominal pain?
No.
Trouble swallowing?
No.
You may have any abdominal surgeries?
No.
Okay, so I would like to ask you to lay down.
Okay.
I'm going to stand at the bedside and stoop down to eye level to assess the contouring. So out of scaphoid, flat, rounded protuberant, the patient's belly is rounded. And also I will now go to the end of the bed, to the eye level, where I will assess there's a symmetry and any presence of bulges or masses. And there are none present in the abdomen is symmetric. Okay. Now I begin to auscultate, noting bowel sounds. I'm going to detect for any abnormal bowel sounds, any hyperactive or hypoactive. So I'm going to start off in the lower quadrant, the right lower quadrant, near the ileocecal valve, where bowel sounds are heard the most. Then I'm going to go to the right upper quadrant, still noting any hyperactive or hypoactive sounds. Left upper quadrant, normal bowel sounds heard, and the lower quadrant. Okay, normal bowel sounds heard. Okay. So there are no hyperactive or hypoactive sounds present during auscultation, and now I will do a light palpation, no more than 1 or 2 centimeters. And I will assess for any rigidity or muscle guarding. Is there any pain?
No.
Okay, so we'll start in our right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, there's another type that's also normal. Now I'm going to ask you to sit back up, please. We'll begin to assess the peripheral vascular ROM inspection of the upper extremities. So, are you experiencing any pain anywhere in the upper extremities?
Yes, up here on my left shoulder, my left arm.
Okay, difficulty moving is like okay. Okay, so I'm going to note. So I'm noting the color, texture, and skin tone. Color is even in skin tone. No lesions or color, or pigmentation or abnormal pigmentation, and there's no moisture detected. Okay, and I want you to. Okay, yes. So now I'm going to palpate the elbows. It hurts right here.
Yes, hurts over here.
Okay. So to the arms and noting any synovial thickening, any deformities. Okay, now go to the fingers and hands. Still no synovial thickening, deformities. Okay, then none present. I'm going to check for the capillary refill. Nose, so press down on the nose and release. Okay, so the color came back there within 2 seconds, so that means the capillary refill is normal. I'm going to palpate the radial pulse. Okay, 2+, which is normal. The rate and rhythm is normal, 2+. Okay, so I'm going to actually strike your, strike your shoulders up.
Mm-hmm.
Strike them down. Strike them down. Okay, go ahead and get your resistance.
Mm-hmm.
See the pain right there?
Yeah, a little bit on the left.
Strike them back down. Okay, so I want you to follow after me.
Mm-hmm.
No any pain. So I'm gonna first bend your elbows.
Mm-hmm.
Extend them.
Mm-hmm.
Palms up.
Mm-hmm.
Palms down.
Okay.
This is what I want you to put your wrist down.
Mm-hmm.
Wrist back up.
Okay.
And the fingers.
Mm-hmm.
Like that.
Okay.
And I want you to extend them.
Mm-hmm.
I want you to touch each finger with your thumb. Okay, now your hand grasp, okay. And I want you to go ahead with this. Okay, now put your arms down.
Mm-hmm.
And I want you to, I'm going to touch for bilateral hand grabs, and I want you to put, what's the name? Try to push resistance.
Mm-hmm. Okay.
Okay?
Mm-hmm.
Okay. Okay, got you. Okay,
Mm-hmm.
that's good. So he's knowing that there's pain within the shoulder or the bicep. And now I will begin to assess, and I will go to assess the lower extremities, peripheral, vascular, and the ROM. So I will, are you experiencing any cramping or pain in the legs, any stiffness or weakness?
None at all.
None of the thing? Okay, so I'm going to ask you to get down.
Okay. Mm-hmm.
Okay, and I'm inspecting for color and moisture. There is no moisture detected. Color is even. There is one levy about 4 millimeters in size on his right leg, right just under the knee. And I'm going to feel for edema. 5 seconds. There is no panic edema. Nope, no panic edema. Temperature is warm by eye, and I'm going to assess the solid speed is above the toe. Okay. And that's I'm going to this regular, and that's on the posterior tibial, or the malleus screw with the ankle, both feet. Sorry. Okay. And now I'll begin to do the ROM. So I'm going to ask you to bend, lift your leg up,
Mm-hmm.
bend your knee outward. Okay, normal, no pain. Okay, lift your other leg up, bend your knee outward.
Mm-hmm.
Okay, any pain anywhere?
No.
Okay, I want you to flex your feet out,
Mm-hmm.
outward in the upper position. Okay, and do that with your toes. Plantar flexion and outward. Okay, gotcha. Okay, so I'm gonna do it against resistance. Plantar flexion against resistance. Lift up. Okay, knee. Okay, outward. Okay, so there's no abnormalities there, and there's no pain anywhere, correct?
Mm-hmm.
Okay, so that is the end of the assessment. That's the assessment, and I want to thank you for your cooperation.
Thank you.
Okay.
Well,
And I want to note that are you comfortable? Are you taking
Yes.
anything else?
mm-hmm. No, I'm comfortable. I'm fine.
Okay, so the patient is safe, and the bedside is back to our level, to the normal level, and at the lowest level, and the patient feels safe. Is there anything else I can get you?
No, I'm fine.
Okay, good. So, I'm a student nurse Messiah Witcher, and today I conducted a head-to-toe assessment on patient Altariq Witcher. Today he came in complaining about a throbbing pain in his upper left arm and shoulder. He rated the pain a 4 on a scale from 1 to 10. The only abnormalities that were detected throughout the assessment were during the ROM and palpation of the upper extremities, where he noted a dull pain on his arm as I palpated. Throughout the other assessments, there were no abnormalities detected, such as the abdominal, respiratory, cardiac, and the assessment of the lower extremities. I would recommend for the charge nurse, I would recommend Altariq take ibuprofen and limit the use of his left arm, and also finding out that he had a most recent surgery on his left arm. I would advise him to begin using the arm sling that was provided to him again. Thank you.